If you have ADHD and executive dysfunction, like disorganization, time management problems, and emotion dysregulation, then you probably already know that the stimulants like Adderall and Ritalin don't do a lot to address these issues. That's where the non-stimulants come into play. And there's a newer one that shows promise at helping executive dysfunction. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. The primary first-line treatment for attention deficit hyperactivity disorder, or ADHD for short, is stimulant medications. They fall into two classes: amphetamines like Adderall, Vyvanse, and Dexedrine, and the methylphenidate class, which are medicines like Ritalin and Focalin. These medications work very well for attention, concentration, and distractibility, and hyperactivity, but they're not so great for directly improving the executive functions. They may indirectly help, like if you're better able to stay focused without distractions, you may be better organized for that day while the medication is working. But once the medication wears off, the disorganization returns. So what exactly are we talking about with executive dysfunction? I have other videos talking in more detail about this, and I'll have them linked to this video. But briefly, you can think of executive dysfunction as things like planning, time management, organization, and even controlling your emotions. But another big one is called set shifting. Set shifting is the ability to switch attention between tasks and then return to where you left off. So let's say you're doing some work and you're in a groove and someone says, "Can we jump on a quick call to discuss this thing? It should only last about 15 minutes and then I'll let you get back to your work." Well, that sounds really benign. It's just 15 minutes, right? What's the big deal with that? For the person without a problem with set shifting, it's not a big deal. You just press pause, do the other thing, then unpress pause, and then it's like you never stopped. But for the person with problems with set shifting, and executive dysfunction is not exclusive to ADHD, and not everyone with ADHD struggles with this. But if you do, that 15-minute quick call can just ruin your productivity for the rest of the day. And yes, that sounds really dramatic, like the rest of your day, really? Yes, really. If you have this, you know what I'm talking about. When you return to your work, it takes so much work to shift your mind away from what you were just doing or away from complete free flow mode where you're just thinking about a bunch of things that you need to do. By the time you settle down and refocus on the previous task, it may be an hour or more later, and now it's time for another interruption. Here's why a stimulant medication may not solve this problem. If you're on a stimulant, you may be in hyperfocus mode where when you have to stop to have that quick call, you may have trouble letting go mentally from what you were doing and be unable to fully engage with the person to talk about something else. It's not like you can't talk at all, but your mind may be wandering while you're talking or listening, and you're not getting the most out of it. But even with the stimulant on board, the interruption pulls you out of hyperfocus, and that's enough to get you mentally jumbled. It's like being on a fast-moving train that derails. The train can still move, but it's not good movement, and the friction brings it to a stop. And similarly, when you're done, you're not going to get back to where you were unless you take another pill, which you shouldn't do if it's not time for you to take another pill. But some people will take a little more just so they can finish their work. And this is probably what is happening when, as the doctor, I'll hear people tell me that the medicine seems to wear off too quickly in the afternoon. That wearing off may be because that the dose is too low or you're becoming tolerant, so it's wearing off. Or it could be because interruptions have caused you to lose your focus and you can't get it back because of trouble with set shifting. So all of this to say, work productivity is more complex when you factor in executive functions. So here's where the non-stimulant medications can come to the rescue. Currently, there are 4 available non-stimulant medications: clonidine, brand name Qelbree; guanfacine, brand name Intuniv; Atomoxetine, brand name Strattera, and the latest one approved in 2021, Viloxazine, brand name Qelbree. Clonidine and guanfacine have been around for more than a decade, Clonidine extended release was FDA approved in 2009 and guanfacine in 2010. They are only approved, though, for children and adolescents with ADHD and still are seen as second choices to stimulants for children who can't tolerate stimulants, or the doctors may use them to add to their stimulant regimen to enhance the effect. They also may be a good choice if you're trying to target impulsivity in a child or adolescent. Atomoxetine, Strattera, was actually the first non-stimulant approved for ADHD in children and adults in 2002. So it's over 20 years old. It's also been used for people who can't tolerate stimulants or as an add-on to the stimulant. In my experience prescribing it, the results for my adult patients was just kind of so-so. The stimulants always seem to work better and faster. Now we have Viloxazine, Qelbree, and a recent 2023 study compared it directly to Strattera. The results were that Qelbree was more effective and worked faster within about a week for children and 2 weeks for adults. Unlike stimulants, Strattera and Qelbree have to be taken daily. Strattera can take a month or more to see a good effect. Both medications are norepinephrine reuptake inhibitors, so they increase the amount of norepinephrine in the prefrontal cortex. This increased norepinephrine has a secondary effect of increasing dopamine and serotonin in this region of the brain. Also in this comparison study of Strattera versus Qelbree, of the people who had Qelbree added to their stimulant, 85% of them tapered off the stimulant after they were stabilized on Qelbree. That's a big deal, to feel like Qelbree was enough to use all by itself and they no longer needed the stimulant. Then here's the other important finding. Another study that I'll have linked in the description of this video showed that Qelbree significantly reduced executive function deficits. The caveat here is that this study was of children, and you can't always generalize those kinds of results to adults. But the fact that the profile of the drug shows that it improves executive dysfunction in children is promising and worth trying to use it for this purpose in adults. Qelbree is still a brand drug, so your doctor may need to complete an insurance authorization in order for your insurance to pay for it. Some insurances will require that you try and fail Strattera before they will pay for Qelbree. Thanks to the Mental Wellness Space store for supporting this video. I am the creator of this online store that offers products like canvas prints, wall posters, tumblers, shirts, digital workbooks, and other tools designed to promote mental wellness. It's wellness woven into everyday life, reflecting my mission to integrate mental well-being into daily living. It's about celebrating and elevating mental health. And just as the shirt says, mental health commands a seat at the table. Join me in pulling up a chair and bringing mental health into everyday conversation. Thanks for watching today. See you next time.